Morning, Charles. Good to see you.
Hey, Christopher.
We're recording this, and for those who don't know, Charles not only my doctor, but he's also my friend. We run together. We may have had a sip of bourbon at some point, but yeah, we just really appreciate what each other does and each other for their business as far as service. And I really love the approach that Dr. Marable has taken over all the years. So when it comes to this COVID-19, there's so much information. So Doc, I just want to kind of get what you think about all this stuff. If you're up for me kind of firing some questions at you, what's a myth? What's a reality during all this? So yeah, if you don't mind, I just kind of want to pick your brain on this.
Sure. Let's talk. What you got?
Okay. I heard that if you start to drink water, it might rush the virus down to your stomach where the acid might kill it, and I don't even know, I heard maybe you should be drinking warm things as opposed to cold things right now. What are your thoughts on that?
Well, I think a lot of these things, we're trying to do our best to avoid getting sick, and sometimes it leads us to thoughts and ideas that don't really have any basis with evidence or science. There's a lot of speculation about things like that. And the water issue, the virus is harder to get rid of than just drinking water to wash the virus down to our stomach, where stomach acid destroys it. I mean, we're just as likely to get virus in the mucous membranes around our eyes or in our nose, and inhale water droplets. So we can't wash it away from our mouth with water. The hot or cold thing, there's no basis for that I'm aware of in literature, in medical literature or science or research. I think that whether the water's cold or hot, it makes no difference as far as preventing infection. But it's well understood that if we're sick, we have a viral illness, warm fluids are often comforting and soothing and help us feel better. So I would choose the warm ones if I was sick.
Okay. Mm-hmm. All right. I will do that. I'll have another cup of coffee here.
Okay.
In a little bit. I hear two conflicting, I'm feeling the sniffles. All right. Is this it? Do I have it? Do I not? What, if I have it, if my kids start to maybe feel sick, what's kind of the age range? When do we, start to go to the hospital, or when do we call the doctor, or what should we do first if we think maybe we have something?
Yeah, great question. I mean, that's the thought we all have. If we have a sniffle or cough, wonder if it's COVID-19 or just a flu or a cold, and causes a lot of worry. But it's important to remember that this containment of this virus is so important. So that's why we can't run out to the clinic or the doctor with every cough, cold, and fever. And it's worrisome because a lot of these symptoms overlap with each other. And so just know that if you are an older person, certainly above 65 or so, or if you have several illnesses that put you at risk, if you have asthma, if you have COPD, if you have cardiovascular disease, diabetes, or some other disease that causes immunocompromise, you're at increased risk, and certainly should call your doctor if you develop fever, cough, or shortness of breath. Give your doctor a call, let them guide you with symptomatic care or instruct you whether you should come in for testing or not. If you're otherwise healthy child or an adult and you don't have underlying health risks that I mentioned, then you should wait this out at home. Call the doc and get some advice for symptomatic care if you're not sure what to do, and treat this like you would any cold or flu that you might have. But if you continue to run fever and you have shortness of breath, you're having trouble breathing, you should probably be tested. And that applies to young kids, healthy adults, or old people. If you're having trouble breathing and you've had fever and cough, that probably needs testing. But because tests are still somewhat limited, you're unlikely to have a test done if you were to go. You certainly don't want to go to the emergency room for just a casual visit, because you'll end up waiting there for several hours probably and get a $2,000 bill and be sent home with instructions to call your doctor about things like this.
Okay. So it sounds like the overriding theme is first thing you should do is call your doctor.
That's a good idea.
That's the first step, rather than rushing off to the emergency room or right into the doctor, and just almost phone consultation first, and let your doc kind of run through the symptoms with you first. Yes. I know. I mean, I've seen people it's allergy season too, and so people are getting stuffed up and all that anyway, and so but now we're kind of on edge. Is this it? Did I touch someone? Was I in the wrong place? I mean, how do you see this spread so easily? Like what are some things that you're seeing, or and prevention?
Well, I think it's the virus, as most everybody knows, it's contained in the water droplets that we sneeze and cough out, and so it can go out into the air and people breathe it in. It can go out on our hands if we touch our eyes, nose, or mouth, and then we touch someone else. If we eat or drink after someone, or if the virus particles land on surfaces that we touch and then touch our eyes, nose, or mouth. And it spreads that way. And I think that we're sort of lulled into some complacency about our protecting of ourselves through the social distancing and isolation, because many of us, we don't know anybody that's had COVID-19. We don't know anybody that's been in the critical care unit on a ventilator or who has died from this. And so it still seems quite removed from us, and a mystery of why we have to hide in our homes for something that we can't see, that we really don't see the impact of. And I think the short-sightedness about that is understanding how the virus does spread in a population. If you think about an example of a pond with a lily pad in it, and suppose that lily pad doubles every day, and so day 2 there's 2 lily pads, day 3 there's 4, day 4 there's 8 lily pads, and by day 30 the entire pond would be covered with lily pads. Well, the first few days you barely notice the lily pads. Even after a week or so, there's still some lily pads over there, but not anything close to covering the pond. But the amazing thing is that on day 29, half the pond will be covered with lily pads. And it's this exponential growth that in one day, it goes from half the pond to the whole pond. And we'll see that if this virus is not contained, where there'll be dozens of cases, hundreds of cases, then thousands, 10,000s, and it will dramatically increase. And that's what these efforts to contain the virus are all about. And some communities are taking it very seriously, others aren't. And, I think we should take it seriously. We shouldn't lose hope, get discouraged, get depressed, doom and gloom, but we need to take this seriously and keep a light heart about it, look for creative ways to encourage each other and stay busy. And we've got an invitation here in this space that we have where our routines have been changed. Let's think of how we can get creative and be innovative and do something beautiful.
Right. Oh, I love that, man. I love that. So proactively, then what can we do? We've isolated ourselves. We're doing the social distancing. And so, but proactively, like, I hear, can you take a bunch, if I took a bunch more vitamins, can I like boost my immunity? Can
Mm-hmm.
I, what we need to be doing proactively, and what is kind of, if you can bust some myths about that for me, what can we be doing that'll actually help, and what can we be doing that, what are we doing that maybe isn't helping so much?
That's a great question. There's so much stuff on the internet that would lead us to believe that we can boost our immune system. And that sounds like the reasonable thing to do, since there's no cure for this virus and no effective treatments that have been proven yet. So our best defense is a good immune system. So it would make sense that we want to boost it. But that's a little speculative too, that we can.
Speaking of lily pads,
here. So it's a little speculative that we can boost the immune system. So
okay,
taking vitamins, certain vitamins, whether it's vitamin C, A, E, vitamin D, certain nutrients and vitamins are essential for a good, healthy immune response. But taking massive amounts of these vitamins doesn't supercharge the immune system. Our body can only absorb so much. We're wasting time and money to take massive amounts. I think, vitamin C is the poster child for these vitamins, but it's been disproven years ago that taking major doses of this helps prevent illness. So if you feel compelled to top off your vitamins, take a multivitamin once a day. That's fine. But the best way to get your vitamins and your minerals and all the nutrients you need is through healthy nutrition. And I know you guys do a great work up there with Heidi and trying to increase awareness about what good nutrition is. So I would encourage people to reach out to Heidi for some ideas on that. But I think for me, for my family, and for my patients, I'm always encouraging lifestyle medicine. That would be preferable. And so I think it starts with, I think to ensure a good immune response or a healthy immune system, you want to take care of your body, and then your immune system will be as good as it can be to fight off illness. And the first thing would be, get good fuel, get good nutrition, get good healthy variety of foods, and let Heidi work with people individually to get very specific and dial in what's right for them.
Okay.
Another thing is sleep. It's very important to get restorative, adequate sleep. This is not a time in our lives to burn the candle at both ends. We need to maybe get an extra hour of sleep, and that will help our immune system. It does so by reducing stress on our body. We think of stress as emotional stress, but we need to think about all kinds of stress, physical stress, relational stress, social stress. And when there is a high level of stress on our bodies respond with a stress response. The sympathetic nervous system kicks into action, releases adrenaline and cortisol, and a sustained level of cortisol over time can suppress our immune system. So if we want to ensure a good immune response, we have to be aware of where the stress comes from and how it's affecting our body and how we can reduce it. So if we're getting poor nutrition, a lot of the wrong kinds of calories, that stresses our body. If we're not getting restorative sleep, our body's under a lot of stress. People who have obstructive sleep apnea, they never get restorative sleep. Their body's under a lot of stress, more risk for heart disease, diabetes, when they have that. The other thing is hydration. You and I were talking the other day. I used to think that most of us were dehydrated. I'm not sure that's the case anymore. I think, but many of us are underhydrated. We probably don't get as much fluids as we should, and that would stress our body. So it's important to get adequate hydration and some exercise. keeping our bodies moving. This is a great time when we're working from home and or we're not working and we have some time. That's something very proactive we can do, is get out and walk for 30 minutes a day and get some exercise.
That's right.
The
outdoors aren't closed yet.
Yes, not yet. And I guess finally, giving some attention to our emotional and mental health. And I think with all the hysteria and fear that's in the media and stuff, we should be mindful and aware of how that's impacting us and focus on that and take some action to do that, whether that's, the exercise can help with that. The adequate sleep will help with that. But I think brain rest activities, like if you meditate, or there's a meditation app called Headspace that I've used in the past that kind of gave me some guidelines on how to do that, and focuses on breathing. And you can do some active breathing exercises, which actually can trigger the parasympathetic nervous system and counter that stress response. And so that's a really good thing when you're feeling tight in the chest, a little lightheaded, short of breath, you feel a little anxious, panicky. You could do some controlled breathing. There's many instructionals online, videos, YouTube things about how to do breathing exercises that can be very helpful in a time like this. So, I think that's something to be mindful of, to lower our stress levels to help ensure a good immune response.
That's outstanding. Well, thank you, man. Thank you for your time today on this. I'm going to keep gathering some questions. I want to pick your brain, a little bit more as well. But yeah, thank you for all your help over the years and our partnership together. But the thing I like best about a concierge doctor in a time like this, I can text you and you text me back. Yeah. I can call the doctor like you're saying and you pick up, so love your business model, love what you're doing. And thanks again for this.
Well, it's a good time. Let's get together again soon.
All right. Will do. Thank you.
See ya.